As with all of these real questions from real people, I'm not 100% sure what this one means, but I'm very, very intrigued. The question is, how can a menopausal woman achieve pregnancy? So, menopausal, meaning that a person has not had menstrual cycles for a year and they're not ovulating and their ovaries are no longer producing eggs. The question is, can they achieve pregnancy? The answer is actually yes, but the means to becoming pregnant is somewhat complicated. So if a woman's not ovulating and not creating eggs, then there has to be eggs from a healthy donor or a healthy younger woman who is ovulating and is willing to donate her eggs. So we call that an egg retrieval and an oocyte or egg donation. There's also such a thing as embryo donation. So these are eggs and sperm coming together to create embryos that are either left over from IVF cycles that other couples have not needed and decided to donate, or potentially created for the purposes of this answering this question that this person has. So for people who cannot achieve pregnancy on their own, whether it's because they're menopausal or because their eggs are not quite high enough quality, or because they've had premature ovarian insufficiency, or perhaps chemoradiation, some other means of not being able to produce their own eggs, including menopause, and oocyte donation or embryo donation with a transfer back into a prepared uterus. So this menopausal woman would have to be on hormones, creating a thickening in the uterine lining so that the embryo um, can be implanted into the uterus in a healthy way to grow a healthy pregnancy. I do want to add a caveat though that if this menopausal woman is older, which of course she is likely older, then there are other risk factors that involve circulation. So, circulation to the placenta, therefore, circulation to the baby can sometimes be an issue. In older pregnancies, there's risk of hypertension, diabetes, placental insufficiency, low growth in the baby. Sometimes we call that IUGR, intrauterine growth restriction, small for gestational age babies. There's some of those factors that can happen in an older pregnancy. Now, this person didn't say older. If this is premature ovarian insufficiency and it's a young, healthy woman who has gone through menopause before the age of 40, then her physiology can tolerate pregnancy a lot better than an older mom could. And so there's a few nuances in this question. But if a woman's not producing her own eggs, it's time to think about donor oocyte or donor embryos and having that woman carry. Oh, one more thing. Gestational carriers, which is like a surrogate, or is not like, it is a surrogate, is also an option for people if they're not able to carry or healthy enough to carry or don't want to carry their own pregnancies. So lots of fertility options to talk about, and I've got some fertility questions coming.